I'd like to introduce everybody to this assignment that we're working here for the Performa and Assessment and Learning. And this assignment is involving the evaluation of an OSCE rubric. So this is a rubric that was used to evaluate student performance. The purpose of this presentation is to evaluate a rubric which was used to assess student performance, so in other words, it's a performance-based assessment. The type of task is an OSCE, and an OSCE is an objective structured clinical exam, evaluated with a rubric. And an objective structured clinical exam is used a lot in the health sciences, in medicine, in dentistry, in a lot of the other radiology, where there is a scenario that is given and the student responds on the moment to the scenario. This rubric that we did the OSCE with is evaluated with an instrument called a rubric for a rubric, which is in our course. So in the section under rubrics, there is a section that's entitled Evaluation of a Rubric, and that's what I used that evaluation tool to evaluate the rubric that we used for the OSCE. The following parameters are examined: task authenticity, alignment, criteria that are used in the rubric, indicators or descriptors or standards which are used in the rubric, as well as content. Okay, the process that was used. 71 students were assessed with a standardized patient playing the role of a patient diagnosed with schizophrenia. So this standardized patient is in fact an actor who is role-playing, who has a script. The actor has memorized a script which describes the reason for hospitalization and present treatment. So the actor knows what he can and can't say. He's also coached and made sure that the actor really sticks to the role. The evaluator is a teacher who observes the interaction between the actor and the student and marks a grid, which is a performance-based assessment. So the evaluator, who is a teacher, has the grid in front of them and is watching the interaction between the standardized patient and the student. It is a tick-off list with 11 criteria. Task authenticity, I will go through each of the categories. So it's problem-based assessment, curricular content and presentation is being assessed. It requires some higher order thinking, example, apply. There are 2 criteria that are looking to see if the student is demonstrating behaviors indicative of the level of thinking of apply. Minimum open-ended. So there are several responses that are accepted for a quarter of the criteria. Again, there are open-ended, but very minimal. The other criteria are very set, either the student demonstrates them or does not. The task of interviewing a patient is real life, yet the circumstances are contrived. We're not really in the clinical setting, we are in the college, and the student is being evaluated. Students are anxious as they are being evaluated, and they realize, and this is part of their grade. It counts for 30% of their grade. There are 5 OSCEs, and each counts for 6%. If assessment is not satisfactory, then the students will not intervene, which is again reflecting real life, because the instructions are assessment and intervention. So this is real life. We don't assess without the possibility of there being an intervention, and realizing as nurses, is there an intervention that's possible? And it involves the higher order thinking of apply, which is a desired behavior in a hospital setting. So in reality, it is quite an authentic assessment. The rubric areas. There are 3 areas that represent the breadth. Distinctly different thinking criteria for thinking skills for each group of criteria. So each group of criteria of the 3 groups, there are distinct thinking skills that the student needs to demonstrate in order to get the criteria correctly. It assesses students' performance analytically. It is a breakdown of their performance in minute points. There is an undistribution of weight. Students can pass 63.6% of this assessment if only the cognitive process or level of thinking of remember is demonstrated. So 63.6% of the rubric involves a level of thinking known as factual information or factual knowledge, which is remember. So skills are assessed independently. So 63.6% of the grid determines content knowledge as the student interviews to determine the nature of the hallucinations. So the cognitive process is remember. 18.2% of the desired criteria demonstrates if thinking of concepts has occurred. So cognitive process is understand. And 18.2% requires application of interventions in the nursing process. Is open-ended as the student chooses their intervention. Demonstrates a transfer of knowledge. The cognitive process is applied. But you can see that remember has the preponderance of the grid. It is 63.6%. Okay, so we continue on the criteria. Most criteria are distinctly clear from each other. And you'll see that there in fact are two that are not, and I explain. Time limit of 10 minutes. Tick off. The student gets a point if the behavior was observed by the evaluator. For evaluators who are oriented to the rubric, the question we ask is there inter-rater reliability when two dimensions of performance require clarification? And in fact, there were two areas of the 11, that could have led to a little bit of misunderstanding. The first one is some subjectivity, as there was no description of each criteria. So there is no description of each criteria. It is understood that the teachers are aware of what each criteria, the scope of each criteria. So an example is a student nurse clarifies the purpose of the interview, and this is somewhat open to interpretation. Does the student clarify it in the first sentence? Does the student clarify it in the fourth sentence? Does the student clarify it? Does she let the patient clarify it? It should be, in fact, that the student clarifies it, but when and how quickly. The second criteria, which is number 5, fifth criteria on the list, knowledge of ways to cope with voices. And so as an evaluator, the question is the student asking if the patient, if they are compliant with their meds? So the question is this thing of knowledge that the patient has, that's a very large scope also. So that could have been narrowed a little bit more, definitely narrowed more, so that the evaluator would be able to see if the student demonstrated, asked that question correctly or not. Conclusions. Task authenticity. Very close to real life. Actors must stick to their role. No deviations, as this would influence the student's behavior. And when it does, the evaluator quietly steps in and says, we're going to do this part of the interview over again. So the evaluator is there to correct. Alignment. There is assessment determining if the student has acquired factual, conceptual, and procedural knowledge, demonstrating the levels of thinking of remember, understand, and apply. So there's the content, and there's the alignment. Criteria, 11 in number, covering 3 areas, predominantly assessing remember. No descriptors, and unfortunately that's flawed in 2 criteria. There is a higher order of apply involves open-ended responses. So there is one criteria where there is an open-end response. Technical soundness and fairness. The performance criteria do measure assessment and intervention. And that, it's very clear they do, and a student needs to assess, then determine if the patient is willing to learn, then proceed with an intervention. So there is actual technical soundness and fairness. That is the way a student does work, and that is the way it does work in nursing. Measure to show the student's level of proficiency. This rubric does allow the student to show off what they know. As per the evaluation tool, it is the practitioner level. So if we go back to the evaluation tool, which says a rubric for a rubric, there are the level of expert, practitioner, apprenticeship, and novice. And in fact, this rubric is allowing a student who is at the level of practitioner to show that they are at the level of a practitioner. Emphasis is on remember. The student demonstrates that they remember well. Levels of thinking of understand and application are well less assessed. The results, this is for interest. The average score involving 71 students was 7.82 on 11 criteria, which is 71%. The median was 72.73%. There is a weak performance. If we break down the criteria, there is a weak performance in the level of thinking applied. 39% of the students who passed demonstrated application, which was for one of the application criteria. The other application criteria they did very well on. Almost 100% of the students did the second application criteria. But one of the application criteria, only 39% of the students who passed demonstrated that they showed that type of level of thinking. Weak performance in the level of thinking, understand. So in fact, 59% of those that passed demonstrated that they had the criteria which showed for understanding. So we can see that both one of the criteria for application and one of the criteria for understanding were not achieved in the students of those that passed, in the group that passed. 21% of this class failed the OSCE, 79% of the class passed. The final conclusion is students demonstrated that they are capable of assessing a patient who has auditory hallucinations, succeeded in 1/2 of the required interventions, because interventions require the application, the knowledge of application. So what is the short-term effectiveness of this rubric when we look at the results? Well, the short term is it gives a student information about the 3 rubric areas. Recalling what is to ask when assessing the hallucinations, linking the concepts, patient's motivation, building a trusting relationship, to the next step, which is application, and intervening by suggesting alternative strategy. So we saw by the results that the linking of the concepts, the students that passed, only 59% did the linking of the concepts. And of the students that passed, 39% did this intervening by suggestion. Okay? There was 2 parts to that. Gives the teacher information about the student's level of thinking and presentation. So the teacher understands that, they do very well in recalling, half the application was done, and half of the linking was done also when it came to understanding the importance of motivation. And gives the student the opportunity to practice the OSCE format, as this will be the type of task in their exams with the Order of Nurses. So this is a practice for them. So in a way it is formative, even though we use it as summative, obviously for marks. This OSCE was with 6% of their final mark. Each criteria is with 0.6. But in reality, this is for them a practice for the final exam. Long-term effects. Okay, allows the student to compare their performance, tracking their progress. This type of OSCE scenario is used in 1st year, 2nd year, and 3rd year each semester. So this is a 5th semester student. They have been exposed to this. This is their 5th time doing an OSCE, where they have a standardized patient. Allows the student to validate their competency in real-life situations, which can intrinsically motivate them to use a mastery approach to their learning. They can break down and say, gee, I did very well in the recall and remember. I did quite poorly in understanding how the patient is motivated to learn or not, and I should be linking that concept, which involves understanding. And in my application, I only did half of what was required in application. I taught a new way to the patient, but I did not go back and see if it was working or not. So there's half the application that's done. Enables the teacher, using backward design, to make changes in learning tasks that will enable the student to use the levels of thinking required to meet the desired criteria. So the teacher can go back and say, okay, there is a lack in these 2 areas of knowledge. The student does not demonstrate these levels of thinking. Therefore, I can make learning tasks where the student starts to use these levels of thinking, and then see if they in fact do use them when it comes to a standardized patient. The student's achievement will be increased as a consequence of the above 4. So that is the presentation.